Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director for the Institute for Healthcare Consumerism, joined with CEO and founder of the Institute for Healthcare Consumerism, Doug Field. Great segment there with Jeff.
Yeah, it was.
And it's very, very interesting what they're doing there at Connecture. They're looking at a lot of different pieces to the puzzle, and those type segments could go on for the full hour.
Yeah, with their PBM piece that they've had for quite some time, they've got and then their involvement in powering Medicare.gov. They have a very unique long arm of experience in exchange. You've got a lot of new evolving players, new players in space. They've been at it a long time.
Yeah, and I think it was an interesting point he made around the voluntary benefits piece. And we see that more and more when talking with the voluntary benefits piece. That's going to be an important, critical part to all of these exchanges that we need to look at, or everybody needs to look at. So we'll see where all this moves. So actually joining us on the program right now is Nancy Scola Lombaer, and she is the partner of health and benefits at Laurus Strategies. Welcome to the program, Nancy.
Hello, and thank you.
Hey, Nancy, nice to have you. This is Doug Field. You've got a interesting bird's eye view of what's happening in this exchange market, and you've taken a unique position. Kind of give our audience a little background on Laurus, and then let's talk specifically about what you're doing around exchanges.
Well, Laurus Strategies is a human resources consulting firm, and I would call us more of a boutique firm. We're not huge. We're mid-sized. But within our health and benefits practice, we, over the past couple of years, have been looking at these private exchanges, and we actually did start thinking, well, we need to determine whether we want to have one of our own or not. But what tends to happen with us is that our main focus is the success of our clients. And we felt that if we did not keep our unbiased viewpoint on things, that we would not be able to be that trusted advisor for them. So that's really the rationale where we ended up where we are on this.
What's your target size company? What is typically, a client size?
Well, we have smaller-sized clients, and I'll say within the 200 employee range, but we go up to 40,000, 50,000 employees. Our target size is probably in the mid area, maybe 5,000 to 15,000.
Yeah, which are the companies that I think need the most help when it comes to understanding whether exchanges fit their employee population or not?
I think that's correct. Yes.
Yeah. Where do you see the exchange market going from your seat?
Well, I see certainly it's a rapidly evolving, so it's a little hard to keep up with. But certainly I think that at least recently and at the beginning of all of this, all of the brokers' consultants were in a rush to figure out how they could get one. I think maybe that might be settling in a little bit, but now there's a lot of the brokers and consultants potentially buying up some of those independent companies that there used to be, and there's probably more of them coming on. I also see some of the things that are changing is that the private exchanges are not rushing, but trying to bolster and add to the services that they're providing for the employer or the customer. So they're saying that they want to offer more ongoing services, not just that beginning open enrollment and decision support kind of service, but potentially a concierge or an advocacy type of service to the employees of the employer on an ongoing year-round basis. They're also adding more products, so it's not just the medical care and dental and vision, but also some life insurance and disability, a lot of the voluntary products, auto home, even the pet insurance, which is popular with a lot of people.
Yeah.
And I think they're really trying to outdo themselves with the leveraging of technology. Getting the social media, the mobile apps. As many of those bells and whistles that they can use to appeal to a younger crowd.
Where do you see the health management piece?
The health management, I'll go back a little bit to the advocacy piece that I was talking about, and I think that there is an opportunity potentially to have an umbrella health advocacy and getting into some of the clinical aspects of that, but it's a real mixed bag right now. So I think for the most part it's still being left to the insurance carriers to handle that for their own plans.
Yeah. Now, Nancy, we had mentioned it on the News and Views, the first segment of the program today. There's a lot of different models out there. So from your seat, what type of private exchanges, could kind of give our audience what those models are and what's maybe best for a certain size employer.
Yeah, and you're right. There are a lot of models because I started, making a list of some of the different types of models, and I think I even surprised myself. But certainly one of the different types of models there are is ones that provide multiple carriers, insurance carriers programs, and ones that provide just a single carrier. So that is, an issue for, let's say you have a national company who has employees all across the country. A multi-carrier program might be the best solution for them because, every carrier has some weak spots with regard to geography. So in order for them to get maybe best in class for each location of their employees, they may need to have more than one insurance carrier. Whereas maybe a smaller or a more, company that has locations only in one spot, it might just be easier to use a single carrier, and many times it's that carrier themselves that are providing the exchange. So that could be maybe easier administratively.
What do you see your employers that you either work with or employers that you're aware of doing as it relates to the mix of, some of my employers are going into a public exchange, some are going into a private exchange, or even if we don't have a private exchange, I'm still sending some of my employees to a public exchange. How do you see that all kind of shaking out?
I don't hear a lot about moving employees into a public exchange. So again, I'm working maybe with the mid to larger companies, and perhaps there's more of those discussions going on with the smaller companies. But with the larger companies, they are focused on they're actually focused on maintaining their own benefits program, whether it's in or out of a private exchange. But they're all just kind of looking at, when they might be able to move into a private exchange, whether or not that's a exit strategy for them eventually or not. They haven't made those decisions. But I think most of the larger employers certainly have been giving all of their employees information about the public exchanges, partly because they're required to, and hoping that maybe some of the COBRA participants will move off COBRA and onto the public exchange. But for the most part, the benefits eligible employees, they're not. I don't think they know what employees' interest is in the public exchanges.
Yeah, I think that's right. I mean, I've heard some of it. We see and hear a lot from the employers we touch that, there's certainly a high majority of employers that, have indicated they're going to look at exchanges. But we see a good percent of employers that are taking, I don't want to say advantage, but taking this opportunity to accelerate their employee population to full replacement, HSA high deductible plans, surrounded by all the different tools and services, and not go to exchange, but accelerate the, their, the full replacement programs. Do you see some of the same?
I don't. I see a little bit of full replacement, but certainly I think that employers are, as you say, taking advantage of some of this kind of market upheaval, if you will, to start making, larger changes in their programs than they have over the past couple of years. I think over the past couple of years there's been a little bit of pausing, if you will, and freezing of, we don't know what's going to happen with healthcare reform, so we're not going to make any big changes because it might take us in the wrong direction. And now they're starting to think differently about that. And start to make some changes that, some employers want to blame it on ACA. Some employers are, trying to make it look as if, this is what we're trying to do for you. I mean,
Right.
It's just different spins. But
Right.
I think you're right. There's bigger changes happening now than there have been.
Yeah, we see the same thing.
Nancy, Doug and I were at a meeting here in Atlanta, a Web Atlanta meeting, and there was a panel of exchanges. I believe it was Aon, Gallagher, Mercer, it was Buck Consultants, and then it was moderated by Benefit Focus. But one of the things that they had mentioned is they're seeing a lot of employee consumers when they get into these exchanges that they're buying down from a benefits standpoint. From a cost standpoint, are these exchanges effective for the employers that you're working with? And also, what are some of the things that most people really don't realize about an exchange?
Okay. Well, from the cost savings standpoint, I think, you're right that there is, whether it be through a defined contribution strategy where, employees definitely have a fixed bucket of money that they can spend, that might cause them or incentivize them to buy down to a less rich plan than they may have had before. And then also throughout that whole process, and I would say that is, yes, they're buying the right plan for them, hopefully, but it's also, in essence, a cost shift to the employee based on what they had before. But that is a cost savings, nonetheless, to the employer. I think what the jury is still out on is whether the private exchanges are going to help or a sustainable lower cost trend for the underlying health care, the cost of health care. So that's kind of where we're still waiting to see how that's going to happen and what they're doing to cause that to happen.
Yeah, I think, there's an element of controlling costs through defined contribution, but does it really control health care costs? I think you're exactly correct.
Right.
We've got about a minute to go, and I want to give you an opportunity to kind of wrap this up and leave our audience with a couple takeaways. Sure.
I would say, and you had mentioned too, what are some of the things that kind of people don't realize or might be a surprise to them? And what we're surprised about is that there are, there's a certain high-level executive that isn't quite sure the difference between a public and a private exchange. So I would start the education with the executives sooner rather than later if they haven't already. I think that once you get into this is very complex, and you, the employer, really need to know what your goals and objectives are, what you're trying to accomplish through all of this, and the lead time that it requires in order to make the decision first, whether this makes sense for you and your HR strategy, or once you do that, or if you do that, then which model is the best for you.
Yep. Well, Nancy, listen, we really enjoyed having you on the program, and come down and join us in May at our IHC Forum. We'd love to have you come down with us.
Well, thank you very much.
And you have a great weekend. And
thank you.
To our audience, stay tuned for the next segment of Healthcare Consumerism Radio.